Good afternoon, everyone. Welcome to our Black History Month program here at the Freedom Center. My name is Asia Harris. I'm the manager of youth programs. We have a wonderful panel set up here today. So I'm going to get started and introduce some names, and then everyone is going to tell us a little bit about themselves, and we'll get the program started. So we have Dr. Crosby here this morning, Dr. Lisa Kelly, Dr. Eunice Blackman, Luke Hughes, and Krista Miller. So if everyone would like to introduce themselves, whoever would like to begin, we'll get started.
Okay, I'll start. We'll just go in the order you called us in. Thank you, Asia, Ms. Harris, for the introduction. My name is Lori Crosby. I am a psychologist at Cincinnati Children's Hospital, and I'm very delighted to be here. So we can talk more about my background and things, but I just want to do a brief introduction now.
Hi, and thank you so much for the warm introduction. It is such a pleasure to be with this esteemed panel today. I am Eunice Blackman. I am a pediatrician at Cincinnati Children's Hospital as well. I work with kids who come into foster care, so as well as complex care medicine as well.
Good afternoon, everyone. I am Luke Thomas Keys. I am a servant leader, and some of the avenues which I serve the community are through my nonprofit organization, True Community, as well as an instructor and an instructor trainer for emergency certifications. Thank you for being here today. I'm really excited to learn from all these great panelists and excited to learn from all of you for attending.
Everyone, my name is Krista Miller. I am a junior chemical engineering major at the Tuskegee University, and I'm very excited to be on this panel today with all these amazing panelists.
Okay, and last but not least, I will let Dr. Kelly introduce herself, as well as giving us a little bit of information about our partnering organizations this afternoon.
Yes. Good afternoon, everyone. And I just want to ask, before this afternoon, were you aware that Black Americans are 4 times as likely as white Americans to develop kidney failure? Or that 33% of all Americans are at risk for developing kidney disease? Did you know that Black Americans make up about 13% of the population, but they account for 35% of all people with kidney failure? And you may not know that diabetes and high blood pressure, which are much more common in African American people, significantly increases your risk for developing kidney disease. Well, if you did not know that, no shame in that, because the majority of people don't know. And that is the reason why Black Care, the Black Care program, which is the co-sponsor of today's webinar, was created. My name is Dr. Lisa Kelly, and I am co-chair of the Black Care program. It's a healthcare program of the Cincinnati chapter of the Links Incorporated. And the Black Care program of the Cincinnati chapter of the Links Incorporated is just part of a larger Black Care initiative nationally. The National Black Care Initiative was created in 2021 as a collaborative effort of the Central Region of the Links Incorporated and Baxter International. The mission of Black Care is to support community-wide intergenerational discussions on these healthcare topics, and more importantly, to empower individuals to be advocates for their healthcare and the healthcare of their families. So you likely noticed, if you read any of the promotional materials, that Black Care is spelled in capital letters, capital K, capital A, capital R, capital E. And it's an acronym. That acronym stands for Kidney Awareness, Resources, and Education. And our goal today, this afternoon, is to do just that, to raise awareness, make resources available, and to begin to educate. So leading us in this goal, we are fortunate to have, who will be joining us soon, Dr. Nita Walker, who's an internist and a specialist in healthcare systems, Dr. Eunice Blackman, who is a pediatrician and an expert in the area of social determinants of health, We also have Dr. Lori Crosby, who is a well-known child psychologist and a specialist in the area of social determinants of health as well at the Cincinnati Children's Hospital Medical Center. They, along with our student facilitators and Luke Hughes, will guide us in this discussion of these very important topics. Specifically, they're going to talk about kidney disease and also the precursors of high blood pressure and diabetes. They are going to dive into the long-term impacts of health disparities and adverse childhood events on our community health and individual health. And last but not least, they are going to talk about ways that you can be an advocate for your own health and that of your families. So throughout this whole session, I would encourage you to ask questions in the chat and take full advantage of their expertise. And you'll also see a link to our Cincinnati chapter of the Links Incorporated website where you can get additional information. So the Black Care Program of the Cincinnati chapter of the Links Incorporated is delighted this afternoon to partner with the National Underground Railroad Freedom Center. And in honor of Black History Month, we are excited to start this conversation with you. So with that, I turn the virtual microphone back over to Ms. Harris.
Thank you for that wonderful introduction. We have a few more people that have joined us this morning. I see Dr. Nita Walker in the corner there. I also see Jayla here this morning. If you all could just introduce yourselves, let us know who you are. Jayla, let us know what grade you're in, what school you're at, and we'll jump back into some questions.
Hi, I'm Jayla. I go to Preston High School and I'm in 11th grade.
All right, and we have Dr. Walker. We will wait for your introduction next as well.
So funny. High blood pressure. It's like they were late to take him to the hospital. As soon as they get there, he was announced dead.
We've got a little bit of feedback. We're going to have our technology person help us get the volume up a little bit, and then we will jump right back into it. Firstly, I wanted to reiterate on what Dr. Kelly said, that she kind of gave us some statistics and some data that might seem alarming or a little bit fearful, but we're here to bring awareness and really spread information about how to decrease some of those statistics and get them in a more positive light. So one thing we're going to start off is just some more numbers. So whoever feels comfortable or has some data that they would like to share, let's share a little bit of data or statistics that are important to your everyday work.
I'll start, Ms. Harris. We see higher rates of anxiety in Black teens, and we see sometimes what they call comorbidities. So you have a physical illness and you have anxiety and depression with it. We also see that more in Black teens, and yet we know that they receive less treatment than others. So I'll start with just that statistic. We'll talk about why today, I'm sure, as we go through the questions.
Okay, and I want to get back to that word comorbidities. I think that's a word we've all become a little bit more familiar with through these last few years, but I think it's also probably something that we maybe didn't know much about before 2020.
You're so right. I think it's a very important word for us to think about, because a lot of times we separate the mind and body, but what we know is they're very, very interconnected. And again, we'll talk more about that this afternoon as we hear from Dr. Walker when she talks to us about childhood experiences and the impact they can have on our health. But they're very connected. So I'll just kind of leave it there and we'll continue on with other statistics that folks might want to share.
And
it's Dr.
Yes, go ahead, Dr. Walker.
Did you want? Okay, it's Dr. Walker. And first of all, good morning and thank you. I am in an Uber and hopefully I'll be in a stable place here in a few minutes. But the things I really would like to share about in terms of health is, so there's good and bad, and there's some wonderful things that are happening, like Black women are getting mammograms at much greater numbers than they ever have before, and actually are leading the pack in terms of making sure that they're getting that particular screening. But then there are other things that are concerning, and one is which that 14% of African Americans report that they feel that their health is very poor. So that's an unfortunate thing. We also know that we have more asthma, more death from cancer and cardiovascular disease, and then higher infant mortality. So those are some of the other key statistics. The other thing I want to point out that's concerning me quite a bit is the rate of smoking. The rate of smoking, especially among Black men, is almost close to 1 in 5 smokes. And if you include other things besides tobacco, the smoking level goes higher. And I always remind people that even if you're smoking so-called herbal products, which we all know what those are, but the bottom line is you're still smoking and you get the tar from it. And it's harmful. And we are seeing an increase in actual related illnesses related to that. So I think that there are several things that we'll talk about over time. We want to talk about things that, like you said, are comorbid. We want to talk about things that that are related to our environments, because I think it's very important that we understand that the narrative has often been that Black people get these things because of what they do. I would also say it's way more important to talk about the structure and the way that things are structured that make it hard for us to avoid getting these things, because that is the real truth about what happens, whether it's housing segregation, school segregation, job issues, and so many other things that impact our community that really relate to the structures and the politics. So more to come.
Thank you.
One thing I guess I will talk about, working with kids who come into foster care, a lot of those kids, unfortunately, have unmet medical needs, unmet mental health needs. And sometimes in particular, one thing I would want to focus on is, the chronic kidney disease in kids. Black kids are more likely or less or slower to get referred to a nephrologist. And then also slower to get referred to for kidney transplantation as well as staying, not only are you slower to get referred to those things, but the rate before you start dialysis or start any of that. So the time between kidney failure and actually starting a treatment for it, like dialysis, or if it's a transplant, you're longer. So that's a longer wait that you have with that. And then because of that, the comorbidities that are associated with chronic kidney disease and being on dialysis, like neural behavior, cardiovascular, you're at a higher risk to develop more of those. So I think that's one thing that we should definitely keep in mind. And just to know that kids are not little humans. So the reasons that they go into chronic kidney issues is not necessarily because of hypertension or diabetes, but more so because they may have had a congenital defect of their kidneys, or they may have had an infection that caused them to have develop chronic kidney issues. So I would just add that piece.
So to follow up to that question, Dr. Blackman, how do we talk about who speaks for these children? Because they're in a situation where, they're technically in the care of someone who may not be their family or, their exact loved one. So who's the person that gets to advocate for these children, or how can the public advocate for them?
So I think starting off with forums just like this, right? So having the education so you can know to, recognize certain things, because we know that chronic kidney disease initial stages are very silent. So just being able to have conversations and recognize it. Now, when it comes to kids, the thing that you have to do is keep them going to their primary care doctor on a regular basis, so that the physician can check their, blood pressure starting at the age of 3, can check and see, if they need to have kidney tests done, check and see what their blood pressure is doing, because those are some of the things, blood pressure, if you have higher blood pressures for longer persistent periods of time, the function of your kidneys can go down. And if you don't have functions of your kidneys, well, you go into kidney failure. So by starting off with keeping them in, so coming to see people like me who do medical evaluations on kids when they initially go into foster care, making sure that foster parents understand you have to get them, seen. You just can't wait around for, someone to take them eventually. It has to be you. And I think definitely starting where you guys are starting now with having these conversations would be very helpful.
Thank you. And we're going to get back to that. Some of those things that we can do to be proactive, some of those things that we can do to really recognize those warning signs in our children and our families and our caretakers. So does anyone have any statistics you'd like to add? Luke, I know we've talked about some interesting things as well.
Yeah, so definitely want to echo Dr. Walker's comment as it relates to removing structural barriers. And one concerning statistic to me that I came across in my field of work is that within Black communities, there's only an 18% chance of receiving life-saving CPR. And that is 30% below the nationwide average. So with that, looking at some of the structural barriers that are preventing access to these valuable skills, this month, All Black History Month, we have removed the barrier of price for free CPR classes that we're hosting All Black History Month. We have also expand access to it by working and networking with organizations like the Center for Closing the Health Gap, which is at where I'm at right now, hosting a class right outside of here. And also my fraternity brothers, Alpha Phi Fraternity Incorporated, co-hosting as well. And so with that, I want to encourage anyone who's on here today to take advantage of this opportunity. A big part of expanding access is being aware that these services exist. And so you all have the privilege of being on here today. You all are now aware that there is a problem and you have the opportunity to take action to better your community. And it could be, you know, your mother, it could be your aunt, it could be your dad, it could be, you know, somebody in your community. And it is better to have a skill and not need it than need a skill and not have it. So I want to highly encourage everyone on here today to really take a moment and every Saturday at 10:30 and 1 o'clock and every Monday at 6:30 during Black History Month, we'll be having these free classes. So I'll make sure I put a link.
You went mute, Luke.
Okay, just put a link in the chat. So if anyone wants to sign up, feel free to sign up. And if you have any questions, please reach out.
Thank you so much. So just to emphasize what Luke said, this is a space that we are creating to provide resources and a place for us to go. If anyone doesn't have a doctor, if you don't know where to get one, you've got several here. They work at wonderful institutions. A lot of these institutions that are on today are some of the top in our country. So that's really a privilege that we have to be working with such high stature folks in their industry. And we really appreciate what you're bringing to us. Once again, Luke and our technology personnel are going to drop some information in the chat on those free CPR programs, because sometimes, you know, emergencies do happen and we want to be prepared. So I want to ask some of the students that we have here today, do you see a distrust within the medical field? We've talked about some of these statistics and, you know, they may be alarming. So as a youth, what do you see happening in the public and how people feel about medicine?
Well, I can speak on that. As I do attend Tuskegee University, as you all may know, there has been the Tuskegee syphilis experiment. So there's definitely a lot of distrust down here when it comes to the medical field due to what's happened in the past. As well as Tuskegee, we really don't have the resources to even rely on the medical field. The nearest hospital is 30 minutes away. It's either in Auburn or Montgomery. So there's really a lack of resources down here as well that I think causes a big distrust, as well as it's not available. Even on campus, our student health isn't even open, let alone 24/7. It's not even open normal business hours. They're open from 8 a.m. to 12 p.m. That's only 4 hours out the day for students to go receive medical help if they need it. So it is a part of distrust, but it's also a lack of resources available that I see within my community.
Thank you. So I want to step into that a little bit as well. So when it comes to that, how can youth be a part of their own health and long-term care, and what small healthy habits can they incorporate into their lives?
Is that for any panelists?
Sorry, yes, that's for everyone. I think everyone kind of covers something a little bit different here: mind, body, spirit. And I think that it's important for students to know every element.
So I want to talk about, so I'll talk about a couple of things, but one is one you probably don't think about much, and that is one is voting. So the first thing you can do is as soon as you turn 18, you need to vote. So many of the decisions that impact your health are related to voting and putting the right people in Congress and helping maintain, for example, things such as expanded Medicare. So I can't advocate enough for getting involved in political processes and making sure that you vote and your voice is heard, and also writing your congressman or emailing them or showing up to town halls. So one of the first things is understand that your healthcare is entirely political, and making sure that you get involved with that, because that is one of the most important things you can do in terms of your healthcare.
Thank you. And anyone who would like to answer can go next. Dr. Crosby, I think maybe you were going to share.
Sure, I'm happy to share a couple of things that are really important. And as we think, I'll try to stick to the mind, although again, the mind and body are very connected, but just a couple things. One is sleep. Sleep is really important for our health. And there is sort of a myth or a, sort of a story that we can sleep when we're dead. You hear people say that, especially among Black women and Black teen girls. We have this sort of superwoman thing that we're trying to do. Hey, we can do this, we can do that, we'll sleep later, we'll do this. But sleep really does, we're finding out more and more, impact our health. And so we really do need to try to make space for it and to value it and to have good quality sleep. So even if you're getting 4 hours and it's good quality sleep, that 4 hours is better than 2 hours or no sleep. The other thing I would say is, if the pandemic taught us nothing else, it taught us that we can pretty much go stir crazy, right? We can at home, it gets to our mind. And so we have to learn to take care of our mind and do some different things with our mind. So there's something called mindfulness that I highly recommend, and it can be done in a variety of ways. Some people do it with deep breathing. Some people do it with yoga. To get that mind body thing going. Other people just do mindfulness by itself. There's a ton of apps. There's all kinds of free ways that we can do it. And I think it's a really important practice. It's something that when you do it, you're like, this is it. This was mindfulness. But if you build it up over time and start doing it every day, you will see tremendous effects in your life, in your brain. Your thinking will be clearer. You'll have more energy. You'll be much more engaged in life, and you'll be healthier. So I'll just stop there.
Thank you. Thank you so much. So this is sort of similar to this last question. So can we provide a little bit of differences between our specialties here today and the importance of having a separate doctor for these things?
So I guess I'm sorry. I will go. So I am a pediatrician, general pediatrician by training, which means that I see babies up until the age of when you turn 21, we'll send you somewhere else to be seen. So from the age of being, just born to about 20 years old, we will see you. We primarily see kids because, like I said before, they're just not little adults. So you need a pediatrician to take care of you because there are some a history that I would probably want to ask that maybe your adult physician may not know to ask, and want to make sure that I'm capturing those things correctly when it comes to trying to determine what's going on with you when I see you, or making sure that you're growing like you should. So just like you have a kindergarten teacher and you have a teacher who teaches English or high school, there's those differences because one is more specialized in that particular area. So that's why you need different specialties, and that's my specialty.
And I'm Dr. Walker, and again, my specialty is general internal medicine. And I will tell you that there's every bit of evidence that if you have a primary care physician in general internal medicine and pediatricians are primary care providers, if you have a primary care provider, your health will be better. So it's extremely important that you have someone who is the person who is the quarterback of your personal team and who is making sure that you get the coordinated care you need and you get access to care. It's also been shown that if you have a primary care provider, you'll have better access. So if you don't do anything else for your care, one of the most important things to do is make sure you are connected to a primary care provider and make sure that that person checks your blood pressure and your sugar annually if you're African American.
Thank you. I wanted to follow that up with two questions. So the first is, let's say we have a PCP doctor and we don't feel that, we have a great connection. We don't care for their method of care. How do we go about getting a new doctor that we find, trustworthy? And also, what kind of things that can we do at home to maintain our health? High blood pressure cups. Those are sold in stores. Things to check your heart rate. I cannot remember the name of the device. Things like that average people have access to, but may not know are necessary to have in their homes. How do we get access?
So one thing I would say is if you go to a doctor and you don't like that doctor, by all means, go find another doctor. You would do this when it comes to your hair. If you didn't like your hairstylist, you'd cut them off in a minute, right? So if you don't like the doctor, find another doctor. Now it's easier said than done because there is a shortage of African American providers. And I recently retired, and when I retired, people were from patient care, people were pretty unhappy because we don't have a lot in Cincinnati. Some doctors will allow you to do an actual interview before you engage in a relationship to determine if they're right for you. But it's important to look at all kinds of resources. Are they board certified? Where did they train? What is their philosophy of care? So those are the kinds of things you want to find out.
Thank you. So getting back to high blood pressure, kidney disease specifically, how can blood pressure or kidney function, how do we control blood pressure and those kind of things? And what's the major thing at risk when blood pressure is out of control?
So I can start. So I think you have to understand what is blood pressure, right? So when you think about your heart pumps blood to every major organ because they need that blood for the things that's in the blood. So like oxygen, glucose, other electrolytes, your organs need those to function properly and pretty much to continue to do its work. So how does the blood get to those organs? It's usually through vessels. So if you think about, if you had a balloon and you put water in the balloon at different volumes, it's going to feel heavier, right? So what happens when we talk about elevated blood pressure, this can be temporary or this can be persistent. When it becomes persistent, that's when it becomes more of a problem. So what can change your blood pressure? Different things. So one, the type of blood, if you want to say it that way. So if you have increased blood cells, anything that makes the blood a little bit more viscous for whatever reason, that medications it may be on or different processes, the heart has to work harder to push that blood through. So your pressure is going to be elevated. The other thing is more volume. So if for some reason you have extra fluid and extra volume around, again, the heart has to work hard to push that out. And then the last thing you have to think about is the vessels themselves. If the vessels constrict, it has to work harder to push that out. So that pressure is going to be even more increased. So when you get increased pressures of your blood supply or system, I should say, circulatory system, your blood pressure will be elevated. Now, if it elevates here and there, probably not going to do too much damage. If it elevates persistently, then the things that you have to worry about is your organs, in particular your kidneys. So if your kidneys is experiencing high blood pressure, what happens is the vessels within those kidneys are going to get smaller. So the kidneys is going to get less blood. If the kidneys is getting less blood, that's less glucose, less electrolytes that it needs to do its job. And so the kidneys are eventually going to start to fail. So when you have, like I said, persistent blood pressures, that's what generally happens. So when we talk about blood pressure, we're talking about more persistent blood pressure when you think about hypertension versus just an elevated blood pressure. Some things that can happen that it can do detrimentally to is one, cardiovascular disease, stroke, and like I talked about, chronic kidney disease as well. And I'm gonna stop there because I don't want to take up all of the talking time.
Well, we appreciate your expansion for sure. And this question might go back to you. What is a good way to maintain our blood pressure, and what is a way to maintain a healthy blood pressure, and what contributes to high blood pressure?
So there are multiple things that are important in maintaining a normal blood pressure. First and foremost, family history is a part of it. And so if you know it runs in your family, it's critical that you make sure, number one, that you monitor your salt intake. Salt intake is very important. And there's a lot of added salt in the American diet. So you want to make sure when you're mostly cooking on your own that you then decrease the salt. Or if you're eating out, and eating out is considered one of the biggest risk factors for getting a ton of salt in your diet, that you're very conscious of that. The other thing that's important is regular exercise. Can't emphasize that enough in terms of the role of regular exercise in helping your heart. And it doesn't have to be fancy exercise. Putting on some sneakers and walking around the neighborhood is what it can help. And then the final thing that's really, really important is not smoking. I can't emphasize, you're going to hear me talk about that a lot, but smoking is definitely correlated strongly with the high blood pressure. And it's really important that we don't smoke. And I mean all smoking.
The other one I would add is stress, right? Managing your stress, because we know that stress can really increase and have a negative impact on high blood pressure. So from a mind-body perspective, managing that stress in a regular way through exercise, through eating healthy, through your mindfulness and other practices, doing something that takes you away, that gives you some joy and restoration are really important thing to control your blood pressure as well, in addition to all the things Dr. Walker mentioned.
Thank you. And this is piggybacking off of that last question as well. So what common elements do we see across the board medically that automatically shorten our lifespan? So that goes for poverty, chronic illness, a lack of mental health services, accessibility. What are some things you all see?
I think that Ms. Miller made a great point about the lack of transportation. So when you think about some of the social determinants of health, and you know, where you stay, where you work, where you play, how those environment influence your way of life. Think back to patients who are on pediatric patients who are on peritoneal dialysis, which allows them to kind of still do some of those things. Well, there are laws that are in place that says that you have to have a particular set of housing. You need to have a room that has a door. So if you stay in a 1-bedroom apartment or, you know, a 2-bedroom apartment with many kids and your place is out in the living room, then you may not qualify for that particular service. When you think back to the times of redlining and residential segregation, kind of where we were allowed to stay as a people earlier in the times, a lot of those have caused us to have areas where most Black people, or a lot of Black people, I shouldn't say most, but a lot of Black people are staying in like where there's food deserts and very much food insecurity. So if you are a patient who has kidney failure or kidney disease, you can't get to a store that allows you to have a low phosphate diet, low potassium diet. Those things play an impact, they play a part on, you know, how you're going to take care of yourself, how you can prevent or slow this disease down from happening. So I think that that's one of the things that I think about when you mention that.
Thank you. So this is another question as well for our students here today. Do you feel that you see African-American doctors often, and what difference do you feel like it's making to you?
I can speak on that. I do try to see a doctor of color quite often. I've been with my pediatrician doctor for about 20 years now, but she just left. So I just recently had to find a new doctor. And my mom, she wanted me to go to the only doctor of color that was at the place where I go to the doctor. So I was able to get in with her. And it was definitely a little different just because I'm used to my normal doctor, but it was still something about it that felt more comfortable to me because I know I've experienced having a doctor that was not Black. And I remember I was going to get my allergies tested. And instead of actually testing me for my allergies, he just talked the whole time and ended up going on a rant how it's good to have Black women playing sports and athletics. And me and my mom were just a little confused because it's like, I came to get my allergies tested, you know, didn't really come here for all that. So that's one bad experience I remember having. So I do try to tend to go to a doctor of color quite often, just because I'm more comfortable and I feel like I'm able to talk more and they could just understand some, you know, things about me, you know, growing up in a Black household. So I found that we have that in common. So yes.
Thank you. And you mentioned a little bit about athletics. And of course, when we are, confronting medicine, that's not necessarily the focus, but, physical activity and whatnot can really enhance our lives. So as an athlete for yourself, Jayla, you play volleyball, right? How has that enhanced your life? How has activity and team bonding built you up as a person?
It's taught me to be like, it's made me more like think more about my health and more about the things that I put in my body, and like just basically overall help me with like being more outgoing and focusing on what I'm putting in my body and how important it is, because if you eat like junk food before a game, it's going to slow you down, and so you have to just make sure that you're eating the right things.
And what does it take? I'm going to ask you another question. What does it take for you to recognize that something might be slowing your game down, or when you do a certain activity, it makes you not feel good?
It could be like I notice like I'm more tired, or like I'm more out of breath than I usually am, or like sometimes you might feel like queasy when you go to like spike or like set or something. So yeah.
Thank you.
Ms. Harris, I think you're muted.
Thank you. When we talk about fear, anxiety, things that make us uncomfortable, whether it's food, an environment, how does fear of everyday safety impact our mental health?
So I think it's a great question. And I think we all got to experience this, unfortunately, through COVID, right? Where we had some everyday anxieties, especially in the beginning when we weren't sure what was happening. That most people in the world were experiencing some level of anxiety. And we got to see the impact that could have on us. What we found is that some people who were already feeling a little anxiety got more anxious, and some people who were isolated got more isolated, which are not good for our mental health. So I think, what we have to do is do strategies to help us manage our own anxiety each day. And sometimes that's, I really believe in family goal setting. This is one of the ways my daughter and I got through the pandemic. We would get up in the morning and we would say, what are our goals for today? What are we going to feel good about if we do at the end of the day? And we just pick one thing. So we might do lots of things. We might go to school, we might, go to work, we might do whatever, but we only have one thing each, and it could be personal or school, professional related, that we wanted to accomplish that day. And at the end of the day, we meet up and we say, did we do the one thing we wanted to do today? And it just created that sense of accomplishment and something to build on. And then we could talk through any barriers or things that got in our way, or if we wanted to change our goal halfway through and say, no, this other thing's better. I'm so proud of myself that I did that. But it really helped to keep some of that daily anxiety under control. And then doing the other things, like we did kids yoga together, just other things to try to manage some of that anxiety on a daily basis. It's these daily practices. They're tough to stick to, but athletes are great at this because they do this all the time, but they know that practicing, you get better and it gets easier. And so that's, I think, the struggle is, how do we build in those daily practices?
Thank you. And this question might go to you as well. Do you recommend family therapy? And for those who don't have access or the resources for that, what do you suggest for healing and building that mental stability amongst families?
So I think family therapy is indicated when there is a family issue. Sometimes we have our own things that we need to work on. If we have our individual goals or individual challenges, sometimes we need individual therapy, but sometimes we do need family therapy because we're not connecting as a family and we need to fix that together. And so sometimes family therapy is recommended in those cases. So I think if you can talk to a mental health professional, they can let you know if it's a situation where the family should be involved, or if it's something that more individually you need to tackle. And sometimes you need to tackle your own stuff before you can move to the family as well. And that's all right as well. So I do recommend it. I think it's a good thing. I think it's hard for us to access sometimes what we need, which is why we have less treatment in the Black community. And I think, telehealth has created an opportunity where we have access to more through Zoom and through other things. So there's a lot of mental health treatment available now that wasn't before. Laws have changed, back to Dr. Walker's point about how important it is to vote, because it's allowed us to provide services across state lines and things like that, which again increases the availability of those types of services.
Thank you. We brought up a term earlier called, adverse child experiences. What is that?
So adverse childhood experiences is pretty much those things that you experienced in your childhood that can have long-term effects that was persistently negative. And they're usually in about 3 categories. So abuse, neglect, and your dysfunctional environment. So whether that's your family household or whether that's your community. So if you think about when you're a child, your brain is developing and it's taking in things that happen to you and it's learning how to react. So for instance, some of my kids who come into foster care, if they have never been held before, if they've always been kind of set in a car seat, always left to themselves, when you interact with them, there's a lot of times there's not a lot of interaction. They kind of keep to themselves. Or sometimes it's the opposite. They may go to anyone and they don't have that sense of, I'm not supposed to trust every individual that I see, because there's not a protection because they haven't had that. So when you think about your adverse childhood experiences, it's those things that have happened to you over time that's been persistent that now has, influences your health outcomes sometimes, well, a lot of times, also in how you interact with your environment.
Thank you. We talk about environment. Luke, I want to kick this question to you. This work is really important for everyone, but what's the specific importance of Black youth having these life-saving skills?
Yeah, it's a very great point. And I think it's very important, obviously, as you said, for everyone to have these skills, but especially Black youth, it's extremely important to have these skills because of the different disparities that do exist. And I think that not only is it valuable to have these skills, but it looks really good on a resume too. So anyone who is applying for a job and they see that you're trained in first aid, CPR, and AED, that's a check mark next to your name. That could put you in front of somebody else who is not certified or not trained. And that can help you, get into a college that you want to get into. It can help you get into a job that you want to get into. And the other beautiful thing about being certified in these life-saving skills is maybe it sparks a passion to pursue something within the medical field. So definitely highly encouraged, to experience everything you can experience as a youth. But this is a great opportunity to improve and grow and develop as a young leader and as a young person in the community. And a big part about leadership, a big thing that I really hold tight to in leadership is servant leadership. And in order to serve the people in your community, in order to serve the people you love and care about, it might come to a situation where you may need to do first aid care on them. Maybe somebody scrapes their knee or somebody gets a cut. And that is part of leadership as well, is being able to give care and show the people that you love and care about them by providing them with valuable skills and providing them with value in this training definitely provides that.
And what careers do you see, Luke, that really entail this every day? We're talking about first responders, EMT, firefighters, in your own work.
Yeah, definitely. So there's the common ones that everyone thinks of, like doctors, nurses, EMT, first responders. But then there's the ones that a lot of people don't think about, which there are jobs that are required by OSHA. Any job that has any type of health or safety hazard associated with them, they require them to have these certifications. So there is a wide variety of jobs that require these certifications, and it'll definitely open doors and create more opportunities once you receive these trainings.
Yeah, and what was your training? What did you have to undergo to get where you are? And you've started a nonprofit pretty early in your career. How did you do that? And what made you start considering that at such an early stage in your life?
Yeah, that's a really great question. And one thing I will definitely stress to young people is take time for self-discovery. I think that's really where it all starts. You really have to be in tune with who you are and who you're made to be. Everyone that's on this call today was made for a very specific reason. And we all need each other too. So I was made for a specific reason to serve you. You were made for a specific reason to serve me and to serve the other people in your community. So really where it started for me was that self-discovery at North Kentucky University. I really started to take time early on in my college career to figure out who I was. And that wasn't easy. It's not easy, especially when you're dealing with a lot of different environmental things in college and transitions in college. But one thing that I really came out of it with was a personal motto, which is God loves me, I love myself. And the best way for me to show God I love him is by loving the people around me. So that's really what drove me to this work. And I was able to pursue different avenues of loving people around me by joining my fraternity, Alpha Phi Fraternity Incorporated, the oldest, the coldest, the boldest, all that, and joining the NAACP. There's opportunities to serve. So get involved in your community. That's a great start to discovering what your passion is. And as it relates to starting a nonprofit organization and starting True Community, this really just came out of my passion. It came out of, the desire to serve and the desire to give back to the community and uplift people. So for any young leaders out there that are trying to, get started or want to change the world, realize that you can. And it just takes, some time to figure out what your purpose is. And once you can figure out what your purpose is, it's, maintaining the dedication to your purpose and pursuing what you want and staying focused with what you want and what God has called you to do. And so I definitely want to just highly encourage everyone to take that time for self-discovery, and it'll really allow you to grow.
Thank you. Another question for you is, do you have any specific organizations that you found to be helpful? I know you mentioned Alpha Phi Alpha Incorporated, but of course there's a rigorous process in order to be in these organizations. So what is an organization that maybe we have open, quick access to? Like, hey, I want to volunteer and be a part of my community next Saturday. Do you have any suggestions?
Yeah, that's a great question. I think that there are a lot of organizations like the NAACP. They have youth and college divisions all throughout Cincinnati and the area. You can get involved. Also, just getting involved in whatever communities you already are in. You don't need to necessarily dive into other organizations. There's communities around you that need your service, that need you. And so that could be as simple as, helping out, being a leader at your Boys and Girls Club or your after school program, or, going next door to maybe a kid down the street who doesn't have anybody to play with and asking him if he wants to go to the park. There's a lot of different ways that you can step up and be a leader in your community. And it doesn't necessarily have to be joining a broad organization, but definitely want to encourage getting involved in whatever way possible that you see fit.
Thank you so much. For this next question, I actually want to kick it to Krista, because I know that you've done a lot of volunteering in the Cincinnati community. You've done some wonderful internship work with some, large companies. What do you feel like led you to chemical engineering, and what do you hope to do to impact the community with that?
Thank you for that question. What led me to chemical engineering was really my love for cosmetic products. I was in a cosmetology program for 2 years, and I have natural hair. So, I'm always doing my hair. So I'm always using these products. So I'm like, let me do something that I'm passionate about. But I like having options. So I didn't want to go into cosmetic science because I want to have the option to move around to wherever I found fit, because I am a foodie. So I do have a love for food. And as you know, engineers touch everything. So I could go work for a food company if I wanted to with my engineering degree. That's why I decided to go into chemical engineering, so I could have more options. But my passion is for making products. I have currently internshiped with Procter & Gamble for the past 3 years, and I am preparing for my 4th summer currently right now. I tend to work in research and development. I have not been able to make it to the product side yet, but I've worked very closely with products and I've gained a lot of insight into what I may be interested in. So I know that's helped me out a lot, figure out what I want to do. But hopefully this summer I'm able to be on a product making side. And even if not, it's just another opportunity for me to learn something else and become experienced in that. But yeah, that's what led me to chemical engineering. And with volunteering in Cincinnati, it has opened my eyes. My cosmetology program, we used to go to nursing homes as well as adult daycares. And that was a completely new experience for us because we had to get trained on how to operate around people who have certain disabilities and so we don't irritate them. So I did like learning that aspect of it and wanting to help people, feel good no matter what you have, no matter what's wrong with you, you still deserve to look beautiful, get your nails done, get your hair done. And that's really what I love and what drove me to that.
Thank you. And you mentioned resources. You talked about your experience at Tuskegee. What resources do you all have to steer you toward a career path? And what would you like to see in schools, either at a collegiate or a primary education level?
Even though we do have a lack of resources, I would say in Tuskegee, we have a lot of programs within the medical field that are well known. Our veterinary program is well known. Our nursing program is well known. I have a couple of my pageant sisters, they're nurses, and it's just a beautiful thing to see. So I do wish we had more resources. I wish they would have a couple of clinicals in Tuskegee. I feel like that would be beneficial versus driving all the way out to Montgomery. So those are some things I wish to see on campus. And actually, just a little tidbit, actually what I'm planning right now, hopefully, I do serve as the Miss Gold for the Gamma Phi chapter of Alpha Phi Alpha fraternity. And I would love to set up something with Mr. Keys if we could maybe have a CPR virtual class, just training, because I know in Tuskegee, unfortunately, within these past few years, we have lost some of our students due to health conditions that some of our students have actually solved. One of our students fell. She was actually from Cincinnati, Ohio. Her name was Naira. And our students had to witness her basically lose her life. And I feel like that's horrible. And there's like a feeling of nothing that you could do. So I think a CPR class would be nice, just so we all have some training. So maybe somebody on campus could, potentially save a life. So I do plan to hopefully implement some of those as my role as Miss Gold. So yeah.
Thank you. Well, we will be glad to see what you implement in the future. And speaking of the future, how do you think technology will change and improve the medical field? And Jayla, that question is for you as well. As a young person, how does technology impact that?
I think it's like advancing the medical field, I guess, and like just helping us to get like more advanced research and different things going. And so hopefully, like when I'm older, and I'm just able to I'm able to experience the advancements.
Thank you. Thank you. So how has the COVID-19 pandemic impacted your views on illness and healthcare? And this is for anyone, even as a doctor, how have you all been impacted?
For me, the number one thing that COVID really brought front and center is a lack of access. if anything that COVID showed is that we really don't have a strong healthcare system, and we don't have good access in this country, because so many of the things that ended up happening didn't need to happen because our system doesn't have the capacity that is needed in the right places. And it was interesting to hear, Krista, you talk about Tuskegee, because one of the things that has truly happened over the past couple of years is rural hospitals and rural healthcare has just been destroyed. We're losing rural hospitals before the pandemic at the rate of several a month. And the pandemic may have quelled that for a minute because those hospitals have COVID patients filling some beds. But right after the pandemic ends, we're going to continue to see that crisis escalate. And many people think of rural healthcare, they think of white people. Rural healthcare is Arkansas. And African Americans in the Delta. Rural healthcare is North Carolina and folks who are tobacco workers who are Latino. And it's New Mexico, and it's the native people and indigenous people in America. So that's one of the biggest things that was tremendously exposed. So we're going to have to now really go back to the drawing board and think about how we improve that. Now, on the bright side, one of the things that COVID did is it showed us that there's a lot of care that we can deliver virtually, and we need to get busy with it. We need to make sure that virtual care becomes more normative, because we can deliver people. And if people don't have the tools to do virtual care, we need to get them.
Thank you. Would any other doctors like to speak on this impact and how we've seen it affect our communities?
I have a question for Dr. Crosby, if it's okay.
Sure.
Dr. Crosby, we've seen an explosion of virtual mental health services during COVID. Can you enlighten us a little about that?
Yes, it has been a great thing that has come out of the pandemic. Our concern as a profession is that it won't stay. We're very, very concerned. Because we are able to reach more people, provide more services. And, some of us only need a kickstart, a tune-up, a point in the right direction. Some of us need more intensive services, and that's fine too. But it has really expanded our reach. And it has also taken away some of the stigma of mental health. So I love when I'm in crowds now, sometimes not very often, but every once in a while when I'm around some people, I get to hear them talk about their therapist, and it's not a big deal. Like, my therapist, whatever, I have my therapy appointment on 1, so I can't do lunch with you guys. I'm like, thank you. This is so great to hear. So I think it has taken away some of the stigma, because a lot of people have needed to engage in telehealth in some format. And it has, what's been great is in the initial stages, when a lot of us were given access to broadband and devices, it showed that if given that access to everyone's point, then we can continue, we can have good outcomes. We're just very worried, and this is like why I can't stress Dr. Walker's point about voting is so important. We're very worried that this will start to go away, and that access will decrease. There are not enough mental health providers, as there are definitely not enough mental health providers of color. And so this is really concerning for us as a profession. So if you all can advocate for that, that would be great. Get out there and vote, and tell your healthcare insurance company, hey, we need to cover these types of services. We need to let psychologists, social workers, work wherever there is a need. It shouldn't matter what state, it shouldn't matter whatever, just wherever there's the need is there. So I don't know if that answered your question, but hopefully it answered
very
part of
much.
it.
It's perfect for our next question. Actually, when we speak of resources and community, I know in Cincinnati a few years ago, infant mortality was a big subject here that we discussed. Do we have grief and counseling that's available for folks who have lost family, lost children, family who's facing chronic or terminal illness that we can't do anything except for help each other?
Right. So a couple of things I would say, a lot of the providers. So for example, if your child is terminally ill and they're at Cincinnati Children's, then we provide a lot of support and services related to grief and try to make sure that the family is connected after the child's death. In this community, there's a place called Fernside, but they have been they're very concerned because they feel like they're not serving enough of the communities of color, and they're trying to figure out how to do a better job with that. And one of the ways that they work is through volunteers. So another thing that all of us can do if we have some extra time is volunteer at somewhere like Fernside, where we can help families who are grieving related to that. They don't have enough volunteers that look like us. So, that also limits the amount of services they can provide. They have training, they have other things for volunteers. And so they're very concerned about that. And then nationally, there are different resources. So there's a National Association of Black Psychologists, and they have directories in different states and communities. And then locally, we have a wonderful psychologist who just recently put together a BIPOC resource, and I'll have to get that link and send it to you. I don't have it right now, but I'll find it and get it to you. It's a link of communities of color professional psychologists in the community who said, I want to be on this list, and you can refer to me. And so it's a list of those providers in our Cincinnati community.
Thank you. So we've got about 30 minutes left here today. And one thing I really wanted to touch on, and we kind of have a bit, is everyone's journey. If everyone could just give us a little bit about, how they got here. What college did you go to? What did you major in? What is a residency like? I think sometimes, students don't have, the most realistic idea of what that takes outside of, Grey's Anatomy or Chicago 911, all those kind of things.
I can start. So I went to college actually in Smith College in Massachusetts. I went to the Medical College of Georgia. I'm going to talk about the Medical College of Georgia, and I'm also going to talk about why pipelines matter and why scholarships matter. And I wasn't proud of the Medical College of Georgia when I went there. Okay, I will tell you, it was terrible. It was toxic, it was terrible, it was racist, in a word, in 3 words. That said, I went there on a scholarship as a Regent Scholar, and I didn't stay in the state, but the goal of those types of scholarships are to get people to stay within the state. So the scholarships matter because it meant that I could go to medical school without coming and being unduly burdened. Unfortunately, one of the biggest crises in healthcare is that many of the programs require students to take out a lot of loans. And we are seeing people beginning to recognize that and putting together programming related to that. And one of the reasons I'm proud of the Medical College of Georgia, because they now have, to create primary care providers, they have a scholarship for that. And they have a scholarship for Black students very specifically. And there's a funny story about that because they wanted me to donate, and I said, I'm not donating any money unless it's going to help Black students. And they kept bringing me all kinds of things, and I'm like, not help. And then they called me and they said, now we got one, what you're going to donate. And so I had to put up, or shut up. And so the reality is that matters. The other thing is that pipelines matter. And because the journey in healthcare is one where you have to do a lot of science and math early on. And unfortunately, a lot of places, education doesn't do enough of that. So I was in a pipeline program for the Medical College of Georgia when I was in high school. When I was in high school, I was introduced to that, and I was introduced to that institution. So pipelines matter. We need more pipelines. There are a lot of people who recognize the importance of this, and we need more scholarships. And the reality is the healthcare workforce, as COVID has laid bare, is desperate for people. So why aren't we really making sure that admissions to nursing school and medical school meets the community need and not set some artificial barriers like 3.8 GPAs when that is not what is needed to be a successful physician, successful psychologist, successful nurse, successful whatever. So get rid of the false barriers that really limit people's access.
I'm happy to go next because I would love to pick up on this pathway pipeline point,
Sure.
because I think it's so important. So I went to a very small college in Columbus, Ohio. It was called Ohio Dominican College at the time. Now it's called Ohio Dominican University. It got bigger, but I liked it because it was small and it was close to Ohio State. So I felt like if I needed big stuff, I could go to Ohio State and I could get my academics and do well in this small college. But it was also, you know, we definitely had some racism and other things on that campus. And I learned a lot of skills about how to, and the importance of community, especially when there's not many that look like you. So the importance of working together to make changes and to facilitate changes. And then I went to Wright State University in Dayton, Ohio for my graduate work. And I happened to be at a program that really focused on diversity, equity, and inclusion. And so I actually had, which was the reason I chose the program, you know, Black psychologists, for example, teaching me, Latino psychologists teaching me, like psychologists who looked like me and understood my lived experience. And that made a huge difference. The pathway programs that Dr. Walker talked about is so important. I cannot tell you. Not only did I receive a fellowship during my graduate school, which paid basically all of my graduate school funds and gave me a stipend each month, the Patricia Roberts Harris Fellowship, which was for underrepresented students. That was so important. I wouldn't have been able to go necessarily without that. So that was extremely important. But right now we are trying to find at Cincinnati Children's young adolescent, well, they have to be a senior graduate and graduating senior or undergraduates who are interested in math and science, exactly what Dr. Walker is talking about, because what we have seen is if we take those students in our summer internship, they go on to be doctors in the future or psychologists in the future or people in public health or other things. And so I just can't tell you how important and how life-changing those experiences have been for our students. And they help us too as professionals, you know, because we're able to build into that next generation, which is so rewarding. So if there are students who are interested, unfortunately, our college one, the deadline has passed, but our high school one is still open. I think the deadline is like March 3rd. So if you know someone who is graduating from high school this year, who is interested in math and science, we have a BRIMS program. I'll send you the link and we can definitely you know, consider students, and it's specifically for underrepresented students for that pathway to get them there.
Really quick, touch on the emphasis of underrepresented. I think we have, you know, a great conversation going on right now in society about, well, why? You know, is this are Black people getting more privileges? Can't you just be good enough and not be based off of, you know, your race?
Dr. Blackman, you were going to tell your experience. Do you want to answer that and your experience?
I can. So I went to undergrad at Loyola in New Orleans. When you talk about recruiting, they did an awesome job of recruiting. Our year was fantastic, gave us scholarships, which makes it important because if you come from a household where you can't afford to go to college, then that's going to kind of cut you off from wanting to do anything else. From there, I wasn't sure if I wanted to be a doctor, if I wanted to do research. So I went to the National Institutes of Health, and I did a kind of like a pre-order program, which kind of helps you decide if you want to do research. And I had great mentors there. I figured out that I really like talking to people and seeing people rather than working behind the bench. I also did some summer programs to help me study for the MCAT and to kind of understand what it would take to be into medical school. And I can't recall, they had different ones. I can't recall the name right now, but when I do remember it, I will definitely send that information. And then I applied to medical school, and I went to Temple School of Medicine, which also did a fantastic job of not just recruiting, but also retaining us, because that's important as well. And then from Temple, I went to did my training at Arkansas Children's for residency. which was a very different experience. It was a great experience, but very different from the programs that I come from. When you talk about, what makes pretty much the difference of actually trying to recruit students, and when you think about some of the admission processes, and Dr. Anita kind of talked about it for a moment, is that you have to convince people that it's not just about GPA. It's not just about, they may have had access to a physician in their household, or their uncle was a physician. So they have these wonderful opportunities to kind of do some of those things, like, shadow opportunities. So there's a combination of things that happens that we don't get access to. Maybe they didn't learn how to, take tests well because they haven't had, they haven't been practicing for years of how to take tests. So those are some of the barriers I think that our children go through. So it's important for people who look like me, people who look like you, to sit on these admission committees, because we need to say, hey, look, it's not all about that. They may have not done this, but this is what they've actually done within the community. Your grades are only going to take you so far, really. So if you look at the MCATs, your scores will only take you so far. It's not going to tell you how you're going to interact with patients. It's not going to tell you if you're going to be a great doctor. So that the whole holistic approach is really needed. And it really starts with being with people who look like us on the admission committees. So that's what I would answer that question with.
Thank you. So you mentioned that word holistic. So I want to speak to Luke. You really emphasize holistic health, holistic care for ourselves. What do you see for the future of True Community?
Thank you for that question. So holistic health just looks at all aspects of wellness. So just to give a brief description of what that looks like, that's physical wellness, that's mental, that's emotional, that's social, that's financial, that's spiritual, and understanding that all of these things are interconnected. You can't have one without the other. You can't try to help someone grow in one aspect of their wellness if they're not doing well in another aspect of their wellness. Excuse me. All right, I was just cleaning up some mannequins from this last training. But to expand upon True Community and just what we are, we're a growth organization. We focus on helping people grow. So we have emergency trainings like I highlighted earlier, but we also have holistic trainings. So really what I see as the future of True Community is continuing to connect with young people like yourselves, continuing to do outreach in the community and giving you all the tools to grow. So we have opportunities, we have wellness plans that we connect with you and help you grow in different areas of your wellness. We have community group wellness workshops where you'll connect with members of your community and not only discuss as a collective how you all can grow, but then discuss how you can remove barriers, provide resources, and create opportunities in your broader community. So the future of True Community looks like all the youth that are on this call today. That's really what it looks like. This is a youth-based movement. This is really more than anything a response to the times that we're living in. We don't choose the times we're living in. We didn't choose to go through 2020. No one wanted to do that. We didn't choose that. But you as young people on this call today have to realize that the only thing you can do is choose how you react to the times that we're living in. We saw Black Lives Matter in 2020 take rise. We saw the pandemic also take rise. 2 pandemics, seeing people die from COVID-19, but also seeing people die from police brutality. And these are the times that we live in. You have a choice. And it's really comes down to that. What will you choose to do as young people? You're going to determine where we go and how we operate. And you have the power to change the world. So that's what this is all about. That's why we have you here today, because we realize you all are powerful. We want to empower you and teach you all the hard lessons that we learned along our paths. So thank you for that question.
Of course. I have one more question for you. You mentioned earlier you've got some free instructor possibilities that are open to the community. What about those other things, such as, like you said, the community volunteering and whatnot? How do they get involved with that?
Yeah, definitely. So you can visit our website, truecommunityhw.com, and any involvement that you want to get with our holistic services, our wellness services, or any other involvement in the community, you can contact us on there, and we can definitely connect you with those services. I will say that it is going to be a lot more outreach to come in the next couple of years, but being that we incorporated January of last year and we founded in 2020, we're still continuing to grow. And if you want to be a part of that growth, we definitely are looking for young people who are motivated and hungry and excited to give back to their community.
Thank you so much. So now we're going to get into our Q&A. We had plenty of conversation and discourse over in the chat. So give me just a moment. We're going to search through here, find some wonderful questions. First, one of our questions. Yes.
I was going to ask, just make a comment while you're doing that, because Luke has brought this up a couple of times, and I just want to reinforce so while you're looking for questions, so the importance of spirituality, leadership, and service, and how important those are both to your mental health and your physical health. And so I didn't feel like comfortable leaving this panel without underscoring that. That leadership and service, that it abounds in terms of your mental and physical health. And so it's really important. And, you were asked before, what can families do? That spirituality piece too, individually or with your family, can make a huge difference. So I just wanted to make sure that was out there before we started the questions and answers.
Thank you. Is there anything that anyone else, would like to include that they feel is important? All right, so one of our first questions is really simple. Someone in the chat asked, how can I get on an email list so that I can join and invite more health professionals in my area? So at our website, freedomcenter.org, you can find all of our events. We have a calendar there. A majority of our virtual programs are free of cost. So you can just register, you can watch from your cell phone, you can call in and just listen. And that newsletter is going to email you about all programs that we have going on: youth programs, adult programs, virtual programs, in-person programs. And we also, of course, are always growing. So just be on the lookout for that information. Also, give me just a moment. Looking for some questions here. Someone asked, the distrust issues are multi-layered. How can the disconnect be reconciled?
I think part of the problem is, especially, I know for me, when I go in and I have a family that looks like me, that's a little bit hesitant about, trying something different or getting labs or whatever the issue is. So before I did this, I actually worked in emergency medicine and urgent care. So it's a little bit different. So sometimes I have families that are a little bit hesitant about doing things. One thing I try to let them know, I understand where you're coming from. I've been there. Came from a family that believed some of the same things. But now that I've been on this side, I plan to take good care of your child. I'm not going to let anybody do anything to your child that I wouldn't let them do to my child. And I understand why you have some of the distrust because of what issues have happened in the past to our people. So I understand that. So please just allow me, to take this time to take care of your child. So sometimes you just have to meet them where they are and understand. It's not going to solve a problem right there. If they let me do those things right away, then that's great. If they don't, then sometimes they'll come back and allow me to do those things much later.
Thank you. So someone else asked, how do you recommend finding a doctor who will be more experienced in dealing with medical issues that are unique to the Black community, especially when you come from a small town that doesn't have really great diversity rates?
That is tricky when you're in a smaller town. One of the things you want to do, again, is if you're able, first of all, you can look online and see if there's information about the provider online. And sometimes that information comes in some unique ways and you find things about people. Once I looked up a physician, and what I found made me go, not somebody I want to see. So sometimes you learn things about what they value, what's important to them, and how and their perspective. So I think that is a really good idea to first start online. Second thing is check with other people who are having successful outcomes and successful relationships. It's still a word of mouth game. So check with people and say, I see you're healthy, and are you getting good health information? Is this someone who could also work for me? And if you're able to do the interview, definitely do. I mean, I know that happens somewhat when people are having babies and they want to interview pediatricians. Some pediatricians still do that. Many don't, but some do. And some doctors still allow you to do an interview so you can see if it is a good fit. But definitely look them up online. You want to also look them up and make sure they have the credentials that you think they should have. So you can look for things such as board certification and license. And those are things you can go online and look up yourselves, because you do want to make sure that they at least have the basic skills. Oh, and I should mention that there are actually resources online that will help you find Black physicians. There's blackdoctor.com and some other resources. There's blackfemaledoctor.com, and then there's a Cincinnati Medical Association, or depending on where you are, there may be a National Medical Association link in your area as well. So there are resources to help you find them.
Thank you. Someone asked earlier, what is a doula? And I wanted to mention that. So you have healthcare and birthing doulas, and we also have death doulas because we do face losses and we need to know how to care for ourselves. So give me just a moment and I will find it among these great conversations that we've been having. And before I find it, someone asked, is family medical history included in researched in foster care services?
So I'm not sure about when you say research. What I can say is it's a medical evaluation that we would take that would be like any other. So we will ask about family history, but and if I may have some information from the previous, I may have that information, but I'm not really sure what they mean in terms of research. If there are research studies that's going on, they generally explain it to you at that time, the information that they're collecting.
Thank you. So I wanted to respond to the question of what is a doula? Someone answered it for us, and there's also a website here attached as well. A doula is a trained professional who provides continuous physical, emotional, and informational support to a mother before, during, and shortly after childbirth to help her achieve the healthiest, most satisfying experience possible. We just want to bring that awareness, of course, to alternatives and options that we have in treating ourselves and our families. So if you all have more interest in that, there is a website here in the chat as well. And that is, that's all on that subject, excuse me, you all. So I wanted to also emphasize some of the things that we have coming up in the future here at the museum. We mentioned scholarships. So we do have a scholarship that is available to high school seniors graduating in the year 2022. This is across America. There is no citizenship status requirements. We've got that question several times since the scholarship has been opened. So it is available to apply on our website. It's actually in a video format. So there is no technical application, but there are a few requirements, a letter of recommendation, and your transcripts and a video that cannot be longer than 2 minutes. There are further details on our website, but I just want to make that available because every dollar counts. Every dollar counts. We also have a program here, which is our Teen Docent program, and that's going to allow students to come into the museum for about 16 weeks and learn the material that's here in the museum, and also engage with other leaders in our industry of African American history and the Underground Railroad. So we're working virtually with other institutions such as the Whitney Plantation, Cleveland Federal Reserve. These are just institutions that we want to, partner with to enhance our students' knowledge and, of course, increase their network. So if there's anything that you all are curious about, freedomcenter.org is our website. We also have Free Sundays, which is an amazing initiative that we've started here. So once a month on Sundays, on the third Sunday of the month, we will have free admission. So come down and see us. And as well, we have a program coming up in 10 days from now. So 2/2/22, we will have a program on food waste. That's going to be wonderful. Another virtual program. It's also going to have a really awesome video component to that as well. It's free. So feel free to, register for that link in our on our website. And we're also going to make sure that when we put this new video or this recorded version out, that we include some of those resources that you all provided, blackdoctors.com, National Association of Black Doctors, STEM, all of those things we'll try to reiterate when we get the program back out for everyone to share. So we've got about 5 minutes left. If anyone has any questions that they would like to raise, any resources that they would like to bring awareness to, feel free. And the scholarship, as well, the scholarship for the Cincinnati Children's Hospital High School Senior Program is in our link. And of course, you can visit their CincinnatiChildren's.org website as well.
And Ms. Harris, I did add the one for the biomedical research high school student one. That's specifically for, students who are underrepresented in medicine.
Thank you. Thank you. And Black Care as well. They have a website with plenty of information. I know we provided a lot of data, statistics today, but these things are all available for public access in order to just become more familiar with what our risks are and resources for healing our communities. So freedomcenter.org, check out our website, get back to us, stay connected with us. And I wanted to ask Dr. Kelly if there's any closing commentary that you'd like to make about Black Care. And if not, then we'll get ready to close our program and win the Super Bowl.
That's right, win the Super Bowl. Thank you so much to all of our panelists. This is exactly the spirit of Black Care. It's just been magnificent. I have learned so much as a physician myself listening this afternoon. So thank you, everyone. I really appreciate all of your contribution to Black Care.
Thank you, Dr. Kelly. We really appreciate this partnership. We appreciate all of you coming on. We appreciate your insight and spreading this awareness. Everyone on this panel today is either in this region or from the region, and it is very willing to increase our, communal relationships. So if anyone has any questions, like I said, my email is available, and there's plenty of information in the chat to kind of keep this service going. So thank you all very, very much today for your participation. It's been a great conversation, and everyone have a safe weekend, and get ready to celebrate the Super Bowl. Thank you all so much.